Okay, in our post-op protocol for scoliosis and kyphosis correction surgery, from 8 weeks to 3 months, we can increase strengthening of the postural muscles and the scapular muscles. We did this in 0 to 8 weeks with just pulling the shoulder blades back and activating the muscles around the shoulder blades. But now we can start to increase stability in those muscles and increase strength. We can't start using resistance until 10 weeks. And so before that, we still can work on scapular stabilization. A good way to do that is like laying on your stomach on a ball and bringing your arms up like this. So we're not using weight, we're just using resistance of gravity on your arms. You can do that laying on your stomach. Sometimes there's a ton of exercises to do this, but laying on your stomach and lifting your arms up and then bringing them up around like this. Maybe we'll do a separate video for that, but after 10 weeks, we can start doing some weights. So a good question that I have a lot of people ask is a resistance band weights? And the answer is yes, it's resistance. It's resistance just like weights would be resistance. So we don't want to add a lot of weight until that 10-week mark. We want to allow the muscles time to recover because those muscles have been disrupted around the fusion. So once you're to that 10-week period, then we can start adding resistance to your scapular strengthening, which is fantastic. This is one of the biggest things that I do in my post-op rehab with my scoliosis and kyphosis patients. So the way that I like to start this is just with a simple row. So after 10 weeks, when things are healed, I like to loop this around like a banister or a doorknob or something like that. And we're just doing a simple row. So we're pulling back, we're squeezing the shoulder blades together, and then coming back. So we want to activate those muscles around the shoulder blades just like we had activated those in 0 to 8 weeks. But we're trying to do it nice and slow, nice and controlled. If you notice, I'm not just throwing the band like this. I'm controlling that, trying to keep some stability. With this, making sure your head is on top of your spine. So I don't want to do this and bring my head forward. I'm trying to keep my head straight on top of my spine so that we're encouraging that nice tall posture. So that's one scapular exercise. Another one is external rotation. So standing with the band in your palms like this, palms up, elbows at your sides, and you're going to pull out and squeeze the shoulder blades together. So go gentle with this one. This one, we're working those muscles directly around that incision, which the soft tissue should be fairly healed by 10 weeks. Still remodeling, but they should be healed and closing. And you're just going to do that trying to focus on your shoulder blades. Let me show you from the back. Your shoulder blades are going to come back and together. So we're increasing your postural stability. Try not to shrug your shoulders as you're doing this, so this isn't this exercise. And we're trying to keep the muscles that aren't supposed to be active, the upper traps, from jumping in and being active. And we're trying to activate those lower trapezius muscles and mid trapezius muscles. This also works the rotator cuff, which is great. I usually have people do 3 sets of 10 of these as well as rowing. It's a good way to look at that. So scapular stabilization, really important, and I encourage you to do that. After you're cleared to use weight, which is usually about 10 weeks, you can add a little bit of free weight, or really, I really like the bands because you can stay upright while you add the resistance. So do something to strengthen these muscles because they get really weak because you just had surgery. So hopefully that's helpful. Work on that posture. Posture is like key at this stage for me. The 8 weeks to 3 months, we can really work on posture with this. And if we don't work on posture, then it tends to be an issue later on. So work on that. If you want some help on working on that, if you notice your head is forward and you can't really get it back, let's proactively treat that rather than waiting until you go in and your surgeon needs you need a higher fusion. We don't want that to happen. We want to address this posture before. So hopefully this was helpful. Keep watching the other videos to find out more exercises as we continue to go through the protocol. Thanks.